You are described as a man who's helped save thousands of lives. Do you accept that mantle?
That's quite a lot of credit for one person. I think two things in response to that is that this movement, the PrEP movement, has been a very small, dedicated group of people, and it comes after decades of work by some very passionate and committed people in a time when we had no hope. So I sort of came in at the 11th hour, and I work as part of a wider group. And also, pre-exposure prophylaxis is a preventative tool, so it's really treatment for HIV that saves lives.
OK, tell us what happened. Tell us your backstory.
Oh gosh, well, I had been looking online and seeing PrEP. It was made available in the United States from June 2012, and I kind of didn't think it was a thing. I was like, if there was a pill that could stop you getting HIV, we would all know about it and we would all have it. And so it took me a couple of years into 2015 to decide I was going to start taking PrEP. And at that time, the summer of 2015, the only way to get access to the medication was to go and get post-exposure prophylaxis, because they give you that drug for free. And one of the drugs in that combination is the drug we use for PrEP. So I thought it was a little bit unethical, because you have to lie and it's wasteful. And the only other option was to get drugs from a person living with HIV who didn't need those drugs anymore, maybe that had changed meds. And that's actually what happened to me. One of my good friends had seen that I'd posted on Facebook that I was going to start taking PrEP and offered me some of the drug to take that he didn't need.
So how did you become aware of the challenges for people who needed or wanted PrEP and couldn't get hold of it?
Well, I guess when we're talking about those people, we're talking about people like me. So there was no information and there was no access. And so I was going to start taking PrEP, and I went for a HIV test the next day after getting hold of the drug, and I came back HIV positive. So it was kind of a little...
What's it like when you find out that you're HIV positive?
It's really weird. It's... in the immediate moment, like for me, time stood still and everything sort of slowed down like you'd see in a movie. Everything moved like it was in treacle. And I went out the front of the clinic to have a cigarette, and I just felt like I was like in a bubble, not part of everyone walking past in Soho. It was just a very, very unusual...
Shock.
Yeah, I guess that's shock. But then a lot of clarity happened for me, and a lot of things crystallized very quickly. I decided I wanted to get on the front foot with it. And I went public about my HIV status the very next day at an event called Let's Talk About Gay Sex and Drugs. And then I posted it online straight after that event, and that went a little bit viral. And so people were like, oh, I can't believe you've done that about your HIV status. And also, what is this PrEP stuff that would have kept you negative? So it was all a huge accident. And after 10 days of 10 people asking me 10 questions a day, every day, I was a bit like, I'm going through some stuff, and there's a problem if the main inquiries of PrEP are coming to me, someone who knew nothing. So that was the genesis of I Want PrEP Now. So it was built out of an accident and out of necessity.
So what did you do? Tell us what you did.
So myself and our co-founder, Alex Craddock, had been at some activist meetings a few months before, and we'd heard that you could import a generic drug for hepatitis C cure for like £1,000 for the treatment that cost the NHS £58,000 or £38,000. So we were like, well, surely if you can do that, well, it can work for PrEP. And actually, generic Truvada is one of the drugs you can import legally 3 months at a time for personal use. So we went to see a friend in the NHS who had some anonymised data of people who'd been doing this and having their blood tested to make sure that it was real drug. And we were assured that it was real drug from a short list of providers. And 6 or 7 weeks later, we launched I Want PrEP Now, and it's traffic. We see about 20,000 unique visitors a month. It's had over 1 million page views and coming up to 500,000 unique visitors in 3 years.
What do people do if they want this drug?
So we have a listed preferred seller, and all they have to do is go through the purchase process. It costs about £60 for 3 months of generic PrEP, and it gets delivered straight to their door. There is a problem there, because I'm the first to say that's not equitable, and not everyone has a fixed address, and not everyone can afford a disposable income of £60 a month.
Not everybody wants people to know that they're taking that drug.
If you're married, or if you're not out, or if you live with a family that's religious, you know, there's quite a lot of stigma around sex in general, gay sex, and still HIV. So that's really one of the crucial reasons why PrEP needs to be available routinely on the NHS in England, which it still isn't.
Where are we as far as that's concerned?
So Scotland have access for everyone on the NHS. Wales have an uncapped pilot, and Northern Ireland have just started a pilot as well. But here in England, they announced the PrEP Impact trial almost 1 year ago this week, I think.
And it was,
yeah, so it was for 10,000 people. They've recently extended it to 13,000. But we know for a fact, and we have data and anecdotes and case studies, that men who have sex with men, gay and bi men, are being turned away from those clinics because they're at capacity, and some of those men have needlessly contracted HIV as a result.
Now, you won't remember that because you're not old enough, but we've got this advert that I remember from the 1980s. Let's have a look at this. And this was, yeah, probably about 1985.
Anyone can get it, man or woman. So far, it's been confined to small groups, but it's spreading. So protect yourself. And read this leaflet when it arrives. If you ignore AIDS, it could be the death of you. So don't die of ignorance.
The campaign, 1986, I'm being told by Steve, my producer. It's not that sort of illness anymore, though, is it? It's something that you can live with rather than die from. And there is a lot of ignorance still about the disease.
I mean, I live with HIV. I was diagnosed just over 3 years ago, and I take my pills once a day, and I pretty much forget about it. But I'm in a very privileged position, you know. There was no collateral damage for me. My family were supportive, and I didn't have a job or belonged to a strict faith group that would penalise me for my sexuality or my HIV status. But the condition itself is a manageable, a long-term chronic condition and equal life expectancy, negative and positive people. But we've made huge advancements in the medicine and treatment for people living with HIV, but we really haven't made advances in what we all can do, which is trying to reduce stigma and make this something that people can talk about and test for regularly. We haven't advanced on that very much at all.
And the ridiculous stigma, I was chatting to the chief exec of Stonewall quite recently. There's a ridiculous stigma still about, oh, well, it's all down to promiscuity, so you're getting what you deserve.
It pains me to say it, but I keep getting asked when I do things like this why PrEP is not available, and it's because it was packaged and resisted as a gay man's lifestyle drug. But the more we do that and the more we paint that picture in the narrative, we're doing a huge disservice to women who are vulnerable to HIV, who maybe wouldn't embrace the concept of PrEP because of that. So, ironically, certain news outlets who are very thinly veiled projecting homophobia are actually doing women and other people who are not gay men a huge disservice while they continue to perpetuate that.
What's the demographic of people with HIV?
Oh, you're going to ask me for figures now.
No,
we have about
100,000
people living with HIV in the UK. But to give you a little bit of context, as in diagnosis, because we often talk about disproportionately affected, but we never put it into context. So until very recently, because we've had some really good news the last 2 years, until very recently, half of all HIV infections in the UK occurred in men who have sex with men, so gay and bisexual men. But we only account for 3 to 5% of the population. So when you take half of the diagnoses into about 5%, that's when we start to understand disproportionately affected. But women, I think 30% of new diagnoses last year were in women. So it's something, but then, you know, we have to really highly target and have a very specific and clear message to get women to understand their risk and to find a way to make PrEP acceptable to them. So there's a lot of work to be done, but I'm glad that we're talking about it openly like this now.
And women are infected because they don't know their partner is bisexual or gay?
Well, I mean, it's not just an illness that affects gay men. I mean, as I said, we're disproportionately affected, but there could be a multitude of reasons why certain women would be vulnerable to HIV. Sometimes it's just not understanding your risk. Sometimes it's not understanding how you contract HIV, and sometimes it's not understanding those other groups that have a lot of HIV prevalence there. So some sub-Saharan African companies, some Eastern European companies, and also you can only be accountable for your own sexual behaviour, and you can only really know that. Anybody else's, it's a kind of guessing game. But it is more highly targeted and nuanced work to talk about PrEP and HIV prevention for women, and we'd really like to see some strong, gutsy, vocal, forward women come forward and start to represent for PrEP for women.
OK, so what do you suggest people do in order to keep themselves healthy and safe? Because, as we were saying, there's still that stigma around people who do not want to go and have an HIV test.
I mean,
because they don't want to know the result. You describe what happened when you find out.
We had some really, really great news from Public Health England just a few weeks ago. Diagnoses of HIV in the UK fell 17% last year. And if we take it in a 2-year run, it's actually fallen by 28%. Wow. But what we're seeing is particularly black African heterosexual men who have sometimes a phobia of the doctor or HIV, presenting very, very ill. So certain demographics are not testing because of the fear of finding out, but it's always better to know. I mean, I think I'm a prime example that you can live healthily and happily with HIV, but the stigma is a huge barrier to stop people from testing, and we really need to start talking about it more openly. And we have National HIV Test Week coming up soon, so that'll be all over Terence Higgins Trust's social media, who I work for, so people can find out where to test locally, and as part of that initiative, through Terence Higgins Trust social media.
And if people want to know more about PrEP and they want to become more active in trying to make it available in England, what do they need to do?
They can visit iwantprepnow.co.uk, and there's a contact email address on there, and they can send me an email through there directly, or they can contact Terence Higgins Trust directly. We have a Terence Higgins Trust direct phone line or an email address, and that will come through to me. And really, get educated, find out what PrEP is, and tell somebody else. And so you know about it now. So tell somebody else when you go home. Tell your son or your girlfriends, and that's how we start to spread information.